Hello and welcome, everyone. I would like to welcome you to the international panel on how to provide urgent medical care to Gaza. My name is Dr. Ruth Gibson, and I am a scholar at Stanford University, appointed to the Center for Innovation and Global Health and the Center for International Security and Cooperation. On behalf of our host today, the Consortium of University for Global Health, and my dear colleague, Dr. Keith Martin, I would
Hey,
like to
everybody.
extend my warm welcome and thank you for your interest in joining us today to have this discussion of urgent steps that are needed to provide medical care to Gaza. To begin, I'd like to comment upon two things before I pass it over to Dr. Martin to provide his comment, at which point we'll proceed to the panelists. The first is that the IDF continues bombings and shellings in Gaza post ceasefire. So the important thing to note here is the most recent ceasefire began on October 10th of 2025. And since that time, over 500 Palestinians have been killed, with close to 1,500 injured after the ceasefire. So this brings the total death toll to 71,667 people and injuries to over 170,000. And as of 2 weeks ago, in late January, the Israeli Defense Forces, the IDF, have confirmed that these numbers are accurate. So Gaza's healthcare infrastructure has been destroyed. And the World Health Organization reports that only 18 of 36 hospitals in Gaza are partially functioning, which brings me to the second main point. The reopening of the humanitarian corridor from Gaza to the West Bank and East Jerusalem is essential for medical evacuations. The United Nations reports as of late December that 18,500 patients, including over 4,000 children, are awaiting medical evacuation for treatments that cannot be provided in Gaza. So I'm going to share my screen briefly here and show you a map that was made by the Stanford Geospatial Center to help you understand what's happening here. The healthcare system in Gaza, as I shared, has been destroyed, and the hospital networks in the West Bank and in East Jerusalem are funded by the Palestinian Health Authority, and this is designed to provide care for Palestinian patients at scale. The important thing to note here is that CUGH, which is the Coordinator of Government Activity in the Territories, which is the Israeli authority responsible for vetting medical transfers of Palestinian patients from Gaza into the West Bank and East Jerusalem, is blocking those routes. So on January 11th, the Jerusalem District Court allowed one patient to be transferred, one patient of over 18,000. So the point to begin this session today is that Israel needs to stop blocking patients in the transfer from Gaza to hospitals in the West Bank and the East Jerusalem hospital network, and they must provide guarantees. COGAT must provide guarantees for Gaza, for Palestinian patients to return to Gaza after their treatment. And with that, I would like to hand it over to Dr. Keith Martin to provide his opening remarks.
Thank you very much, Dr. Gibson, and thank you very much for attending this very important session that we're holding on an urgent crisis that's taking place right now in Gaza, as Dr. Gibson mentioned. And great thanks to the wonderful speakers that we're going to have who are experts in this area and are going to provide their knowledge to you in terms of what is needed to enable, particularly the children in Gaza, to receive the care that they have. As Dr. Gibson mentioned, there are over 11,000 children needing urgent care. And to put it, to need care. And to put this in perspective, those children are injured, they will have lifelong disability, and they need care that they cannot access in Gaza at all. In addition, there are 4,000 children with cancer and other diseases and trauma, cancer, and other problems that require urgent care, that if they do not receive this care, they will die. So you have thousands of children right now in Gaza requiring urgent care. And as Dr. Gibson mentioned, there are ways for that to happen, ways for them to access care in East Jerusalem, ways for them to access care in a broader way in countries in the region, and in particular, Qatar, UAE, and Saudi Arabia. Egypt has done a lot to take in a lot of patients, but there's a lot of capacity in the region that can be deployed. Whether these children, colleagues, and friends receive this care, in fact, is a political choice. To enable them to have care is a choice. To deprive them of care is a choice. And the purpose of the session is for you and anybody listening that has the power to enable these children to have access to this care, to shove the politics to the side for a moment. Think that if these children were your children, what would you want them to do? Would you want them to have? And so, our heartfelt appeal to all of you as you listen to this is please, please appeal to the political leaders that you have access to. Open up the opportunities that we're going to provide today by our wonderful speakers and just enable these children to have the care that they urgently need, save their lives, and enable them to reduce the disabilities that some of them are going to have. And with that, I'll send this back to Dr. Gibson, who will introduce our really wonderful panelists that we have today. Back to you, Ruth.
So I'm going to introduce our panelists in a slightly different order than what you saw on the flyer, because our colleagues in Gaza have intermittent internet access, and we will hope that they will be able to join us shortly. So with that, I would like to introduce Dr. Thayer Ahmed, who is a board-certified emergency medicine physician. He is based at Advocate Christ Medical Center in Chicago. Dr. Ahmed has worked in conflict zones and crisis zones worldwide, Syria, Lebanon, Turkey, Kenya, and his focus is on the situation in Gaza. He has worked and served in Gaza's Nasser Hospital, and as a result of that work, he's an outspoken advocate in international media outlets such as Democracy Now! And NPR. I'd like to mention that one point of note is that he walked out of a private White House meeting with former US President Biden in April of 2024, which, when I shared that with my husband, said is likely a mark of good character. To signal to the US administration that more urgent steps are needed to end the genocide, to increase humanitarian aid, and at that time, in April of 2024, to prevent an Israeli military offensive in Rafah. He, alongside Dr. Sidwa, who's with us today, is one of the three American doctors featured in the documentary film American Doctor that was at Sundance a couple of weeks ago. He has been honored with multiple humanitarian awards, such as the Global Emergency Medicine Award in 2025 for humanitarian service. Dr. Ahmed, thank you for joining us today. It is a pleasure to have you with us. And with that, I hand it over to you.
Thank you, Ruth. Thank you very much. I really appreciate that introduction. I'd like to kind of dive right in and really just kind of try to frame this in a understanding that this is a policy that we are seeing take place with respect to what's happening in Palestine and very specifically in the Gaza Strip. And I believe, and I will try to demonstrate, that there is a deliberate effort to undermine Palestinian institutions, to undermine international solidarity, and therefore see a ultimate displacement of people out of Palestine or inability to survive and make the region uninhabitable. I'll first like to just mention that we have seen unfold, especially on the ground in Gaza, a direct assault on healthcare institutions, healthcare workers, and aid workers. We saw over 1,000 healthcare workers within the last 2 years be killed by Israeli airstrikes. We've seen dozens of physicians be abducted and held in Israeli prisons. And one of these, probably, I would say, more notorious events was the gunning down of 15 first responders in Rafah, Palestinian Red Crescent workers, UN workers, people who were responding to a call with their lights on in their ambulances and fire trucks who were gunned down by the Israeli military. We have seen that the leaders in Gaza, the Palestinian leaders of healthcare response, of public health, we have seen them all either be abducted or killed. Adnan al-Bursh, one of the more famous orthopedic surgeons, was tortured to death in Ofar military prison in Ramallah, the West Bank. We saw Dr. Hussam Abu Safiya abducted from Kamal Adwan Hospital, a northern pediatric hospital. We watched Dr. Nahid, somebody I worked closely with at Nasser Hospital, watch the Nasser Hospital get abducted, get raided, and Dr. Nahid himself be abducted and still in Israeli dungeons. And we saw somebody like Dr. Marwan al-Sultan, who was the director of the Indonesian hospital in the north of the Gaza Strip, be killed in an airstrike after he finished his shift and went home. So it is no coincidence that these pillars of healthcare in Palestine are being hunted down in the way that they are. And this is besides the actual physical infrastructure of these hospitals, of these clinics, of these shelters being bombed and reduced to rubble. We're also seeing a suffocating blockade and refusal of international access, people being able to stand in solidarity, and a failure of something called deconfliction. When you operate in these zones, because you are not a warring party, for example, you provide your coordinates, you report the work that you're doing, and we're seeing an intentional breakdown of deconfliction. And I will just mention a few different things that have taken place over the last 2 years in Gaza that really illustrate that this is not just a random incident, not a random misfiring. In April of 2024, of course, we saw the World Central Kitchen see three of their vehicles be hit with an Israeli airstrike, killing 7 people. In October of 2024, we saw Oxfam dispatch 4 Palestinian water engineers to repair water infrastructure in Khan Yunis in the south of Gaza, all killed in an Israeli airstrike. We saw a UN safe house in March of 2025 who was tasked with removing unexploded ordinances. We saw that house get bombed and somebody being killed. And we saw the IRC as well as Medical Aid for Palestine, their compound get shelled by the Israelis as well. So there is an effort first to physically assault the healthcare system in Gaza and to bring the Palestinian healthcare workers to their knee, but there is also an active effort in terms of international response to make it unfeasible. And then, of course, I do want to mention that there is, in this moment of a quote unquote ceasefire, the continued blockade that has existed long before 2023 on the Gaza Strip that's preventing commercial goods, mobile homes, the adequate construction materials from entering in a way that we can have some degree of response at scale. And finally, the siege and the forced displacement of Palestinians and the disconnecting of Palestinians across Palestine, as we have mentioned at the top of the hour. An Israeli court recently ruled on a 5-year-old Palestinian boy who had been living in the West Bank since 2022. He has aggressive bone marrow cancer and he needs a bone marrow transplant that's not available. And the court ruled that because of a security policy that's being instituted by the security infrastructure in Israel, that he would not be allowed to get the life-saving care that he would need because he is originally from Gaza, even though he's been living in the West Bank for 2022. Even though the Palestinian Red Crescent has deployed teams for the last decade into Gaza, healthcare workers and first responders from the West Bank to Gaza, since October 2023, that has not happened. And so I see that there is a purposeful dismantling of Palestinian institutions and the way that they can connect with each other. It should be no surprise to anybody on this call that the best outcomes for Palestinians will probably be the result of Palestinian healthcare workers treating them. And that the more that Palestinian institutions are able to develop and thrive, the better outcomes that we will have and the more our communities can thrive. And at this point, I feel that there is a deliberate effort by the Israelis to deepen this sort of medical apartheid, this thing that we had talked about previously, even before October 2023, whether it's drowning Palestinians in red bureaucratic tape, preventing their approvals to get life-saving cancer care, or it's the prevention of dialysis machines or MRI spare parts from entering into the Gaza Strip. And so on this final note, I will just say one thing, and I do hope that Dr. Ahmed Al-Farra, as well as Mr. Iyad would be able to join this call because they are on the ground. They have obviously witnessed what has taken place over the last 2 years. But I would encourage and a call to action to everybody would be to continue to center Palestinian voices from the ground in the field, to amplify their voices, to build solidarity through partnerships, through working together, through producing whatever, whether it's literature or media. And I think that the more that we're able to do that, I think the more that we'll learn and that we'll be able to grow, but the more that we'll be able to prevent the full implementation and success of this policy that ultimately results in an erasure of Palestinian civil society, Palestinian services, and Palestinians. So I'll stop there. Thank you very much.
Thank you very much, Dr. Ahmed. I received a WhatsApp message from our colleague, Dr. Iyad, and he has a weak internet connection. As soon as it's stabilized, what I will do is I will call him on WhatsApp and he will speak to us through a voice WhatsApp connection. My messages are currently not being delivered quickly because of the unstable internet, so we're working on that. In the meantime, I would like to introduce Dr. Mikhail Feldin. Dr. Feldin is a senior pediatrician and pediatric rheumatologist. She works for the Gray School of Medicine in Tel Aviv, Israel. She has over 20 years of experience and is a leading voice in highlighting the devastating health impacts of the genocide on Palestinian children in Gaza. She has written for outlets such as the 972 magazine and Haaretz, detailing the harrowing conditions inside Gaza. She has co-authored numerous letters and petitions with hundreds of Israeli medical professionals demanding a permanent ceasefire to end attacks on Gaza's healthcare infrastructure and the release of Palestinian doctors held without charge. Dr. Feldin, it's a pleasure to have you with us, and I'll pass it over to you.
Thank you. Good evening. Thank you so much for inviting me. It is a great honor to be sitting on this panel, hopefully, with medical personnel from Gaza who will join. And if they will be able to join, I think it is an historical moment. I think such a live broadcasted event hasn't happened since October of 2023. I'd like to paint a picture for the people that don't know the situation in Israel and Gaza up close. The distance between the hospital I work in Israel and Nasser Hospital in Gaza, where Dr. Al-Farah, who I hope will join, works in, is 90 kilometers. And though we correspond, me and Dr. Al-Farah, almost on a daily basis, and I see us as friends, we can never meet in person. The imaginary line that creates a border between us will never allow Dr. Al-Farah to come here, will not allow me to enter Gaza and help. And it didn't allow Dr. Sidhwa, who you will hear next, to enter Gaza for his third volunteer mission. I can't send equipment, I can't send medications, nor can I help in any way with the treatment of patients. The only tool I had during the war, and I still possess now, is to bear witness to the stories of the genocide, stories that Dr. Al-Farah tells me and writes, and to advocate for them in Israel. It isn't much. In fact, it's almost nothing at all. 2 days ago, while I was sitting in my primary care clinic treating healthy children, Al-Farah texted me at my request cases of children that needed medical evacuation. More and more stories of children with different conditions, cancer, congenital cardiac malformations, metabolic diseases, liver and kidney failure, kids that are going to die without an immediate medical evacuation. You have to understand, proper diagnosis can't be made without simple laboratory tests that are still lacking. No biopsies can be taken. Basic medications are missing. And even though children can theoretically get dialysis in Nasser Hospital, they don't have the equipment for vascular access to initiate it, and they don't have chemotherapy to start treatment for cancer. Ideally, the world needs to help rebuild the healthcare system in Gaza and make sure all necessary equipment and medications enter the Strip immediately. But in reality, this isn't happening, and it will probably take years until the Gaza healthcare system returns to its pre-war state. In fact, some aspects have been exacerbated by Israel's recent decision to deny access to numerous leading international aid organizations in Gaza. Also, ideally, the world needs to accept thousands of patients from Gaza for life-saving medical treatment, but that also isn't happening in a sufficient pace or amount. Evacuations to third countries are delayed, have led to inconsistent and very expensive treatment, have an unclear acceptance process and prolonged uncertainty for families. The Rafah crossing, which opened almost 2 weeks ago, isn't meeting the expectations we had for medical evacuation of patients, but more so, Israel isn't really allowing for patients to return back to Gaza. And they are using it as another tool of displacement and not a tool for saving lives. The humanitarian corridor to the West Bank and East Jerusalem offers an immediate and viable lifeline. The Palestinian healthcare system in the occupied territories has always served the population of Gaza. In fact, there are hospitals in East Jerusalem where almost 40 to 50% of patients were from Gaza before the war. It is part of the same system, like Dr. Gibson said, that worked in collaboration in the past and offered treatments that were not available in Gaza even before the war. All we are asking is to evacuate patients from Palestine into Palestine. They will only need to cross for half an hour in Israeli territory to do so. Israel's resistance to reopening the corridor has no justified basis. Israel is fully aware that all evacuated patients and their companions undergo scrutinizing security checks. The treatment and accommodation costs are covered by either international partners or the Palestinian Authority, and that every logistical detail is open for coordination and negotiation, leaving no legitimate reason to block the humanitarian corridor. Also, thousands of patients from Gaza were treated in Israel over the years, and no security threat was ever related to patients. As it was said here, legal efforts have been made in Israel. 5 Israeli human rights organizations filed a legal petition to the Israeli Supreme Court demanding the reopening of the humanitarian corridor in November. This petition is pending. It will probably take too long to help dying patients. Like Ruth said, in January, the Jerusalem District Court allowed one adult patient from Gaza to travel to Nablus in the West Bank for treatment of cancer. It could be a precedent, but unfortunately, the same district court this week denied access into Israel for a 5-year-old patient with leukemia who needs an urgent bone marrow transplant. Court hearings are lengthy. They can't be relied on in Israel's current judiciary atmosphere. We need outside pressure and support to facilitate this effort to open a humanitarian corridor for medical evacuations. We need your help to save lives. Thank you.
Thank you, Dr. Felden. I will just show the map again because I'm receiving a number of questions regarding those who might have missed the very beginning. Here's the map. So the Palestinians within Gaza, we're talking about the transfer of patients into the Palestinian healthcare system and the hospitals in the West Bank and in East Jerusalem, which is part of the healthcare system. Just to recap on that. As soon as Dr. Felden, if I could trouble you, we do have this problem for those of you joining us online in our team meetings when we're trying to coordinate with unstable internet connections. But Dr. Felden, if I could please trouble you to try to connect with our colleagues on the ground in Gaza to see if you can reach them while I introduce Dr. Sidwa. Dr. Feroz Sidwa is a general and critical care surgeon, and he's also board certified in neurocritical care. He is a humanitarian surgeon, having worked extensively in Palestine and Ukraine, but also in Burkina Faso, Zimbabwe, and Haiti. He has written extensively about humanitarian surgical work, including the genocide going on in the New England Journal of Medicine, the Journal of American College of Surgeons, and so forth. He was one of the doctors, as I mentioned, featured in the documentary American Doctor. And I was fortunate to meet Dr. Sidwa in December of last year during the Children in War panel, also hosted by the Consortium of Universities in Global Health. I am honored to call him my friend, and I am much happier since I met him. And with that, Dr. Sidwa, I turn it over to you.
I'm also much happier since meeting you, Ruth. So yeah, I don't have honestly much to add to what Thayer and Mikal said. I really hope we can get Iyad and Dr. Al-Farah on, because their firsthand testimony is so important. Thayer and I have both worked in Gaza, but just for a few weeks at a time. It's really nothing compared to the grinding heroism that the Palestinians have shown, that our Palestinian colleagues there have shown. I'll just reinforce a few points that Mikal and Thayer both made. The first is that the deliberate effort to undermine Palestinian institutions, and in fact to just completely separate the West Bank from Gaza, it's a long-standing U.S.-Israeli project. It goes back to the Oslo Accords, the Declaration of Principles that was signed then. And that's probably the major reason that that the simple evacuation of sick children, which is politically inconsequential, is so adamantly opposed by Israel and ignored by the United States. But this is one crucial reason why fighting against this kind of thing is so important. The necessity of recognizing what I think it was McCall that said that we're only asking for Palestinian patients to be moved from Palestine to Palestine. There's no one's demanding that Israel take them in. No one's even demanding that other countries take them in. There is plenty of Palestinian capacity with the right understanding, the right cultural context, the right language skills, etc. And most of the Palestinian physicians are trained quite well, and in fact, they have a lot of international help coming to them in the West Bank and Gaza. But the undermining of these institutions and the separation of Gaza and the West Bank, and then also especially of the West Bank from East Jerusalem, is a critical part of the ongoing destruction of the Palestinians. And this is just a major problem. But to go back to what Keith said, Keith at the beginning implored you to speak to your politicians, and there's a reason for that. It's because these are all just political decisions, unfortunately. And they have a profound effect on human health, like anybody who's been to the West Bank or Gaza can see immediately. And then just one other thing that I'll add, McCall and Thayer both said there's no legitimate basis on which Israel is blocking these transfers of patients. Like Ruth pointed out, it's about a half-hour drive from Gaza City to East Jerusalem. You could walk it in a day. I mean, it's not hard. It's not far at all. But it's blocked, and that's really quite contrary to international law, which both the U.S. and Israel are signatories to. And I don't want to make things about me, but my recent case makes things really kind of just starkly shows how ridiculous the argument about security is. So I was supposed to enter Gaza in November of last year. That was like somebody mentioned, it would have been my third trip there, and I was blocked from entering. So when I was blocked, I hired an Israeli lawyer. He filed an appeal with CUGH that didn't go anywhere. But I had also been asked by two professors to come give unofficial seminars, and also I wanted to meet with PHR Israel and Gisha and other Israeli NGOs that are doing good work. And I was scheduled to visit Israel after I was going to be in Gaza. Well, I wasn't let into Gaza. And so I stuck around in Jordan, and finally I said I'm going to fly to Tel Aviv and see if I can get in because number one, I want to meet these people, but number two, I'm actually supposed to be in Hebron in April in a few weeks, and I want to know if I'm going to be let in or not, because if not, I need to find somebody else who can take that spot. But I said, to myself, I said, well, obviously they blocked me for security reasons, right? So obviously they won't let me into Israel. No, I entered Israel just fine. There was no security issue. I didn't hide why I told the Israeli border guards exactly why I had been in Jordan. I told them I had been blocked from entering Gaza. I told them I've been there several times. I told them I know several people there. They weren't concerned about security at all. So it's not a security issue, and that justification really should be thrown out the window. It's just obvious that it's not a security issue. Small children and their mothers don't pose a security threat to anybody, just like I don't pose a security threat to anybody. So I hope everyone will take what Keith said to heart. Please do contact your politicians and just make it clear to them that these are things that are not only, these aren't requests, these are demands of the law. These are laws that the United States wrote after World War II. There's no reason we shouldn't be adhering to them, and there's no reason Israel shouldn't be either.
Thank you, Dr. Sidwa. I appreciate it. before it does not appear like we are going to be able to that our Palestinian colleagues in Gaza are going to be able to join us. The Dr. Feldon, thank you for calling. The calls aren't connecting, um, which is I think challenging for all of us. I spoke to Dr. Alfara about 20 minutes before this session, and everything was fine. But this is the nature of the fact that internet is cut and is weak for our colleagues, in addition to the massive challenges that they have faced over the last close to 900 days. But before we move on to questions and answers, I would like to introduce both of them to honor the fact that they had committed to being on this panel. And it should also be noted that we have a joint forthcoming publication in the Lancet Global Health. Dr. Feldon, Dr. Froese, Dr. Alfara, and Mr. We are all publishing together on this issue. It has been accepted, and it will be coming out in the next Lancet Global Health publication. And with that, I will introduce our Palestinian colleagues. Dr. Ahmed Al-Farah is the head of pediatrics and maternity at NASA Medical Complex in Khan Yunis, Palestine. He serves as the head of pediatrics and maternity, and over the last 860 days, he has faced enormous challenges from this genocide, from acute shortages of medicine to treating children who have been bombed and ravaged by starvation. He has dealt with medical staff who have collapsed while on duty. In addition to his frontline clinical work, he is a powerful voice in the international media. He has spoken for ABC News, CNN, and Democracy Now, bringing about calls to the end of the genocide, to combat famine, and to ensure that medical access is not blocked from entering Gaza. I would also like to note that when I was collaborating with our colleagues at Physicians for Human Rights Israel, that it was Dr. Al-Farah's daily briefs that was the first thing that we spoke of. And next, I would like to introduce Dr. Iyad Almawi. He sent me this overview yesterday so that I had exactly the introduction that he wanted me to give, and so I will give it now. He is a computer engineer from Gaza. He serves as a safety and security advisor for numerous charities, playing a key role in medical evacuations of children during the war. Dr. Almawi has led and continues to lead numerous humanitarian initiatives, supplying food and clean water to vulnerable families. He participates in numerous international scientific conferences addressing famine, genocide, and the hidden barriers to food access in Gaza. Prior to the genocide, Iyad conducted computer science research and developed computational models in public administration and humanitarian planning. And currently, he is advancing his studies in disaster management, given the engineering and structural impacts of the destruction in Gaza. And on a personal note, I receive his briefs every morning on the situation inside Gaza, and we'll look forward to them both being with us next time. And with that, I would like to open up the floor to questions from those joining us online, and we will, Keith and I together, will direct those towards the most appropriate person.
With the Palestinian physicians in the audience, I don't know if anybody else would like to talk or say something. I mean, we can suggest it if they can. I saw a few names.
I think
I saw a few names that I recognize. I don't want to directly refer to them, but if anybody of the Palestinian physicians who have joined want to talk, we'd love that.
And Elizabeth, perhaps, Mikhail, you can give we can put that into the chat. And Elizabeth, I believe that you can help us unmute participants. Yes. We have 163 people with us online.
Yes, if you're able to identify, Michaela, who they are, or if they could put their names in the
They,
chat, saying they'd be willing to talk.
if I
I'll
could suggest, sorry to interrupt you, Elizabeth, to Mikhail's point, if I could suggest to follow up on that, they could put, if you want to be identified and say something, please identify yourself in the chat and say you'd like to say something if you are a Palestinian physician. And then, Elizabeth, you could unmute
Thanks. Yes.
them, only
I
them, that would be good. Thanks so much.
yes.
Thank you. Yeah. In the meantime, if I could ask a question, Ruth, just to our wonderful panelists, um, give us one thing that in the chat people are saying. What is the one thing that they could do right now um, with regard to directly supporting a humanitarian organization on the ground in Palestine that's providing care to children and the injured? Is there anybody you can suggest or give them any guidance with regard to that?
If I could say something about that too, I think it's actually an important question. I don't want to name a single organization, but what I do want to point out is anybody that was already working in Gaza beforehand, or for example in Palestine. I think that's important. They had a footprint already. They work very closely with the local healthcare workers. They make sure that the local healthcare workers are the primary stakeholders and they're the ones that are sort of directing the care. I think that's very important. And then, of course, I would be remiss without mentioning UNRWA. UNRWA is not a Palestinian institution, it's a UN agency, but in the print, essentially in its mission, their core sort of objectives includes the right of return, which I believe has made it a very significant target to sort of dismantle UNRWA. It's a massive operation. It employs a significant amount of Palestinians. It has been on the ground for over 75 years. And so I think also supporting an organization like that, it has implications that go far beyond just sort of the initial program. So I do recommend people take a look at who's been on the ground, who makes sure that they're centering Palestinian voices and Palestinian leadership and relying on Palestinian leadership to be able to direct programs. I think that's very important.
Thanks so much, Dr. Ahmed. Excellent points. Um, any other recommendations from any of our panelists before I turn it back to Ruth? Okay. Did we see anybody in the chat that wanted to speak who are Palestinian docs? So as Dr. Felden said, it's very important that we hear from you. Um, okay. Ruth, did you want to ask a question at all, or?
Sure. Wendy Feng's had a question for all the non-Palestinian members of the panel. I think that most people on the chat can read this, but I'll read it to those who are joining us online watching this after the fact. So, how do we assure ourselves that those who support human rights and the resources directed to medical evacuation do not further worsen the ethnic cleansing and re-education of Gazan youth? Um, Are attendings here aware of how the IDF freely patrols hospitals in the West Bank and land? Okay, so I will answer that first. And Wendy, my fundamental belief as a scholar engaged in global health in geopolitically fraught areas of the world is that um, research and scholarship and panels such as these have the opportunity to bring people together. And the small example, incredibly small example that I gave, but of us joining forces with our Palestinian colleagues to co-author, a concise piece of what needs to happen in terms of this humanitarian corridor and clear action steps is one way that, I mean, I suppose in the exploration of human rights because I focus on health. And so I don't know if that adequately answers your question. But, I think that this is an exercise in global health diplomacy, for what it's worth. And Feroz, perhaps I'll pass it over to you, Dr. Sidwa, to comment upon that. before I move
Sure
on.
thing. Why don't we let Kadra speak first, if that's okay, and then we can come back to that if you.
Oh, great.
Hello, everyone. I'm Dr. Khadra Salami, pediatric oncologist from Augusta Victoria Hospital, working at East Jerusalem and living in West Bank. So, just a few words to explain the current situation. Actually, we have the hospital in East Jerusalem, and you can imagine how near to Gaza Strip. So before the war, we are one of the major hospital in East Jerusalem that immediately evacuated these children, patients, cancer, adults, pediatric, kidney issues to our hospital. And also we have the East Jerusalem Network Hospital at Al Maqasid Hospital, General Hospital for general pediatric. We the general surgeries and orthopedic. So actually, before the war, we can accommodate with almost 40 to 50% of the cases come from Gaza, and the other will be can be managed in the West Bank. Unfortunately, since the war, we don't have any patients allowed to come to East Jerusalem, to any hospital in East Jerusalem. And unfortunately, the majority of the employees, the medical staff working in these hospitals are from the West Bank. So our entrance to the hospitals in East Jerusalem is controlled by the CUGH, by the permission to enter the hospital. So it's not actually allowed even to us to speak about any patients, and the rights for these patients to come from Gaza. So unfortunately, we are now dealing with the patients coming from West Bank, and we have the vacancy to accept these patients, but unfortunately, it's not allowed even to ask for the rights for these patients to come to the hospital. We have the collaboration with Al Ahli Hospital at Gaza. Our hospital, it's a Lutheran World Federation based hospital, so try to communicate with the hospital. They succeeded to operate the CT scan there. We have consultation by phone, and unfortunately, it's not easy to send medication or any help for the hospital there. So I think the pressure will come from outside if we have to work on, returning this corridor back to the before the war. And I think this is the only way to help patients, because we are, as mentioned, Palestinians, and we can give support to each other easily without any visas, without any problems. And the Ministry of Health, the Palestinian Ministry of Health, is covering these patients for free because they are in a Palestinian hospitals treated. So this is the things that I want to highlight, and hopefully can do something in this urgent corridors to be allowed to patients from Gaza. And thank you so much.
Thank you, Dr. Salami. If I could, if I may, Ruth, if Elizabeth and Feroz mentioned that Habib Rahman from Nasser Medical Complex is on, could you open, if that's okay with you, Feroz, could we open up Elizabeth the line to Dr. Rahman?
Yes, he has
Sorry.
audio access if it's working.
Okay, Dr. Rahman, can you speak?
Yeah, hi. Sorry, let me just get to somewhere where there's a little less noise. Can you hear me?
Yes, thank you very much. Thank you. Thank you for joining us.
Oh, you're welcome. I had a question related to the previous presentations, but is there something else that you wanted to ask me first?
Could you introduce yourself maybe first, Dr. Rahman? Tell us where you are and
Yes, certainly. I've been at Nasser Hospital for a month now. I'm a cardiology consultant from the UK.
and can you tell us what you're seeing there and some of the solutions to address and enable the patients you're seeing to receive the care that they require?
With regards to cardiology care, absolutely the main problem is the blockade. There are almost no cardiology supplies getting in. Basic pacemakers, treatment of ST elevation, myocardial infarction, both in terms of drugs as well as cath lab supplies, are all extremely difficult, if not absent. So what we would consider basic cardiology care in resource-rich countries is being systematically denied here by the Israeli government and its Western allies.
From any of our speakers, is there any questions you have for Dr. Rahman?
Dr. Rahman, is it your first time in Gaza?
Yes.
Gotcha. How does it compare to other places you've worked in terms of the deprivation of supplies and the reason that the supplies aren't there?
In some ways, it's the inverse. I've worked in a couple of resource poor countries before, and actually I've tended to see the inverse, whereby the suppliers are often there, but what's not there are the skills, organization, training, infrastructure. Here it's the inverse. I found the knowledge and the skills of my Palestinian colleagues here to actually be quite excellent. Of course, it has a very frustrating effect in so many ways on the care that's received. It's all very deliberate, and we should fully emphasize that in this webinar. This is entirely deliberate. This is not an accident. This is a deliberate consequence of Israeli policy. And I found it somewhat distasteful to then hear that one of the solutions here is to evacuate the population. Front and center has to be to lift the blockade, not to evacuate the population.
And that gets back to the question Wendy raised as well, which is that in what way, when there are so many people that need to be evacuated for medical care, at what point does doing that actually assist in the U.S.-Israeli goal, which is totally illegitimate by any possible stretch of the imagination, of ethnically cleansing Gaza? And that's a very hard question to answer. I honestly don't know. I honestly don't know the right answer to that. It's very difficult to look at somebody who needs something that is not available in Gaza now, and they need it now, and it is available somewhere else.
Sorry, Dr. Sidwell, I'll just interrupt you if you don't mind. The doctors here are perfectly capable of delivering the clinical care that these children need. They are capable of doing it. These children don't need to be taken to a foreign country so that they can be treated by doctors who think that they're better. The problem is the blockade.
Mm-hmm. Yeah, I couldn't agree with you more, but I just want to emphasize Palestine is not a foreign country. The point that's kind of the main reason that people are talking about a humanitarian corridor between Gaza and the West Bank, as opposed to the evacuations outside of the Palestinian territory, outside of Palestine. But I completely agree with you, Dr. Rahman, that not only are the Palestinians capable, they're highly capable. I've been there twice myself. They're very impressive. And I couldn't possibly agree with you more. The problem is exactly the blockade and the destruction of Gaza's whole society, and especially the hospital system.
Perhaps it would be a good idea, Dr. Salami Kadra, if you're willing to speak again, given that you are providing care and have been since the beginning of the war. Perhaps you can comment on this discussion.
Yes, thank you. So in East Jerusalem, we have a network of hospitals at Al Maqasid Hospital and Augusta Victoria Hospital. We are dealing with almost 2/3 of the patients coming from Gaza because of the geographic proximity of Gaza. Before the war, we succeeded to treat the majority of the patients, and the rest transferred to West Bank. So we can manage, dealing with the major issues, general surgeries, orthopedic surgeries, oncology, adult and pediatric, and most of the dialysis and kidney problems. Unfortunately, since the war, we don't have any patients referred to our hospitals. We're trying to push hard on, having the patients again from Gaza, because it's the only way to help these patients, not waiting until they are referred outside Gaza. It's not a proper way to transfer them outside Gaza. The best is to return them back to the way that we have. Also, we have accommodated hotels. The majority of the patients come for radiotherapy, which is important treatment in cancer. We can handle more than 100 patients at a time. They can stay in the hotel. They can have the radiotherapy. They have the sessions of chemotherapy, and this is for free with the donors for our hospital. So I think the healthcare system in Palestine can manage these patients, and a lot of countries actually is happy to help because of the financial issues that the Palestinian Authority is facing. So the only way is to open the border for the patients, and I think this should be, happen by the governmental force, because I think like it's not allowed for anyone from the West Bank to talk freely about this issue. So it should come from a political decision and the government. And thank you.
Thank you, Dr. Salami. That's very helpful.
Ruth, sorry, can I just add one thing maybe for people who don't understand? There are no Palestinian child or adult, no one who is attempting to receive care outside of Gaza, be it in the West Bank or a foreign country, is sent out of Gaza on the word of anyone other than a Palestinian physician. Every single person who is referred out by a Palestinian physician. And I completely agree with Dr. Rahman that the reason they're being forced to do so is largely the blockade. That there's no question about that. But I don't want anybody to think that it's like, like me and McCall or something are sitting here deciding whether or not these people need to leave Gaza. It's that is always a decision made by an employee of the Palestinian Ministry of Health in Gaza, not by anybody else.
Can I comment on that, please?
Please do, Dr. Rahman.
Thank you. I'm not sure what it solves to advocate the transfer of these patients, both adults and children, with the cooperation of the Israeli government to another part of Palestine, when in fact it's the Israeli government that is creating the conditions that needs this roundabout way of trying to do things.
Dr. Salami, perhaps you could elaborate and answer Dr. Rahman's question, and Dr. Feldon, perhaps you would like to weigh in just to indicate the way that CUGH used to manage patient transfers before the war.
Yes, so just to make things clear, East Jerusalem is controlled with a checkpoint. So even we are living in West Bank, in Ramallah, in Hebron, in the north, in the south, we can't enter to East Jerusalem without special permission. So anyone who is not working in East Jerusalem, in hospitals as worker, cannot have a permission to enter to Jerusalem. So it's similar for Gaza. Gaza was controlled by a siege for more than 17 years. So it's not allowed for us, even as a Palestinian, to enter to Gaza, or patients or doctors or anyone from Gaza cannot allowed to go out from Gaza. So everything is controlled by a permission by the CUGH. And this happened actually for us as doctors to enter to our hospitals in Jerusalem, and it is controlled by a permission. Anyone work in East Jerusalem should have a permission. For the patients coming from Gaza before the war, we have to apply for the CUGH from the hospitals in Gaza. They have to apply for a permission for these patients that they are patients and need transfer to hospitals in East Jerusalem, Palestinian hospitals in East Jerusalem. And then the permission is done by a CUGH. It's fully checked for the patients himself and for the companion. And unfortunately, before the war, most of children referred to our hospital come with an old lady because most of the mother, they are young and they are not allowed to come with their children. So the child come with an old lady, a grandmother, and they come to our hospital. And for the other, patients, the adult patients, they are usually delayed checking until they have one with any security issues to come to the hospital. So all these happened with a security check and come to the hospital. After they finish their treatment, they will be back to Gaza for the chemotherapy, for example, every 3-4 weeks to come to the hospital. And during their stay, they are under the supervision of the hospital. They stay in the hotel. They come with a special shuttle. They come to the hospital and they back to the hotel. We don't have any security problems with the patients. We don't have any events. And all patients I'm working in Augusta, Victoria for more than 10 years, and we don't encounter any issues with the patients coming from West Bank or from Gaza. So this is something that we negotiate also, and we talk about that these patients, they come for treatment. So they are checked, they are under the, security checkup every time they come for treatment.
Can I just mention something here? What Dr. Khadra is mentioning is before October 2023, this has been a system that's established, and it was referred to as medical apartheid, right? Because the people in Gaza were still suffering this blockade long before October 2023. And we are talking about 60 to 70% of people who are applying may get approved. There were delays. I mean, this was a system that was set up. And so I think there's two salient things I will say about this. First is we can lift the blockade, we can bring the entry of supplies. But if we do not address the fact that all of these things took place in Gaza in the last 2 years, and there is no degree of accountability whatsoever, then it will happen again. And we saw since 2009, multiple aggressions on the people of Gaza, multiple healthcare infrastructures and physicians be killed in the process. And we continue to kind of go back to the framework of let's open up the borders, let's try to bring supplies in, when the reality is there's been no accountability whatsoever. That's number one. And the second thing is, and just as somebody who is watching sort of Palestinian land and people slowly be evaporated and erased, the people of Gaza are Palestinians. The people of the West Bank are Palestinians. The people in Jerusalem are Palestinians. We are all Palestinians, and the people in the diaspora are Palestinians. And there is an effort to break that connection. So there is also a political purpose here that could be served by making sure that as a people, we're still connected and we are still together. I mean, I think that's also very important here. Like Dr. Khadra, a physician in East Jerusalem, should be able to be treating patients from all over Palestine, and Palestinians should have access to care. And so I think it goes back to what are we going to do about what's happened over the last 2 years? Yeah, we're trying to do a response and a recovery. But there's something that took place here that's clearly violated every single international humanitarian law, all of the principles that we're supposed to be abiding by. Are we just going to move on and expect Gulf countries to fund the reconstruction and allow a board of peace to further separate Palestinians from Palestinians? I mean, I'm very concerned about that, to be honest with you.
Thank you, Dr. Ahmed. Before I hand it over to Dr. Martin to close, I will enter my email into the chat alongside the lead research assistant who works alongside Dr. Sidwa and I. If you have suggestions pertaining to research that you think needs to be undertaken, you are welcome to write to Olivia. And if you have comments about the international panel today, you are most welcome to write to me. I'll enter that into the chat now. And with that, I would like to thank you all for attending, and I will pass it over to Dr. Martin.
Thank you very much, Dr. Gibson. And I'd really like to thank your leadership in helping to co-lead and organize this very important webinar. Importantly, we at CUGH are exceptionally grateful for all of the amazing speakers that you've heard today. Dr. Thayer Ahmed, Dr. Feroz Sidwa, and Dr. Michael Belden. Also to the our individuals who came in and spoke from the region.
Thank you,
Thank you
Dr.
very much.
Salome.
Sorry?
Thank you.
I just wanted to
Dr.
thank
Salome,
Kadra.
yes.
Thank you, Kadra.
Thank
Thank you. Thank
Yeah, George and Dr. Rockman too. We're really grateful. Your comments are exceptionally powerful, as is for all of those who have been and served in the region. Moving forward from our perspective,
Thank you, Dr. Martin. Thank you,
no,
Dr. Martin. And
thank
I'm hoping that the focus remains fully on Israel's perpetration and continuation of this genocide, not on roundabout ways of trying to evacuate people from the region. Thank you.
Yeah. No, yeah, Dr. Ackman, I mean, just to be clear, we're not, that definitely is not our goal at all. And as we said in the beginning, all of our goal here on every person on this panel, and you and Dr. Salami and everybody who's been kind enough to join us on this webinar, all of you are trying urgently as one first step to open the door in a very difficult and terrible situation is to focus on the children, enable those children to get the care that they require as close to their home as possible, and to stop, as we say in medicine, do no harm. So it's stop the ongoing bombing and taking place in Gaza. Really, I would encourage you to contact the individuals you've mentioned here with the emails. Contact Dr. Gibson, contact myself through info@cugh.org. This particular webinar will be shared online at our website at cugh.org. We have a conference coming up in April 9th to the 12th, here in Washington. Please attend it if you can. You will meet some of the people here who have been very interested in working on this issue. We would love to be able to meet you, put our heads together, and advocate effectively to be able to make the changes that we want. As Dr. Sidwa mentioned in his comments, these are political choices, and people can move political choices. If the public can move the political, and if we're able to do that through this webinar and through ongoing efforts, which will take place, then we will enable the children and adults in Gaza to receive the care that they require and to hopefully move towards a peaceful two-state solution that will enable both Palestinians and Israelis to live in peace together and get us out of this horrendous situation. Anyway, thank you everybody for joining us. Take good care, and thank you for all you're doing for the people of Gaza. Bye for now.